Part of accessing more personalized care starts with test results. Dr. Cottini, what testing should take place following a myeloma diagnosis?
So once somebody is diagnosed with multiple myeloma, there are different types of tests that they will need to get. Some are blood tests, some are urine tests, some are bone marrow tests, and others are just different type of imaging. So the reason for all these tests is because multiple myeloma can kind of go everywhere and can cause damage to different type of organs. So if we look at like blood tests, usually you will see that you will get a complete blood count. So we can count the number of red blood cells, white blood cells, and platelets. And then we'll look at kidney function through like a chemistry profile, calcium levels, because multiple myeloma can affect bones and also can affect kidneys. And then you will see some more sophisticated tests that are really important for the diagnosis of multiple myeloma, but also for monitoring and seeing if you're actually responding to the treatment or you are progressing. So these two tests that you can see are kind of like difficult to say, but they're very important, needs to be remembered. So one is called serum protein electrophoresis with immunofixation, and the other one is light chain-free light chain assays. And practically with these two tests, we can identify the specific marker of the multiple myeloma cells. And that is either something called monoclonal protein or M protein or a couple light chain numbers. And as I said before, these numbers can be monitored. So with response to the treatment, they should go down. And then unfortunately, if we see progression, they might go up again. And urine tests can also look at the same type of like numbers. Usually we ask our patient to keep the urine for 24 hours, so for a day. And we can see if there are this monoclonal protein or this light chain there too. Then there is a least favorite test of all of them, that is the bone marrow testing. So this is very important for us because it's where most of the myeloma cells stay, and we need to have a look at the bone marrow. So we'll need like a piece of the bone and some of the liquid tissue to look at specific characteristics of the myeloma. And then I said before that myeloma can go to bones, so we need to kind of get some imaging of the bones. These are usually a set of x-rays. It's called skeletal survey, to see if there is any area that is abnormal or a risk of fractures. And then more recently, we're also looking at PET scan. That is a more sophisticated test that is based on sugar consumption. We know that myeloma cells in our cancer cell enjoy eating sugar. So with the PET scan, we can see visually where the myeloma cells are in the body.
Okay. What is cytogenetics?
So this is a really interesting question. So cytogenetics or FISH tests are practically tests that allow us to look at the chromosome of the multiple myeloma. So everybody has 46 chromosomes, right? But multiple myeloma cells can have more of them or less of them. So they can have, some myeloma cells have 70 chromosomes instead of 46. So cytogenetics and the karyotype counts how many chromosomes they are. And then there is another type of test that is called FISH test, or fluorescent in situ hybridization. I get all the difficult names. That practically look at specific area of chromosome and can tell us if some areas of chromosome are lost. That's what you can read as deletion, so practically missing pieces of chromosome, or there are extra pieces of chromosome. These are the amplification or gains, or if there are different pieces of chromosome that stick together, and these are the translocational chromosomes. And all of these data are important for deciding, for knowing how aggressive or difficult to treat is your myeloma.
Dr. Cottini, what mutations or abnormalities are you looking for?
So there are different type of like DNA tests that we can do. One is this like FISH test, and that kind of like can tell us, and this is kind of like a standard test that is usually done practically everywhere. And and it practically tells us if there are specific deletion or changes. And we don't really have yet specific medication that we know work for that specific abnormalities. But like all this information are important to decide, as Dr. Roscoe said, number of drugs, and maybe they can be helpful in the future when hopefully, thanks to the research, we are going to be able to kind of say, based on this abnormality, you will benefit more from this type of treatment. There are other type of tests. One is called kind of like DNA testing. So we look at the mutation. So really the small changes of particular gene. This is done not routinely, but I think it can still give lots of good information. And there are lots of genes that are abnormal in myeloma that has potential drugs that have been studied both in multiple myeloma and in the other type of cancer.